Long time no see, this is YouTube Medical University. This is sudden, but have you all been feeling tired easily lately? Do you get out of breath just by moving a little? Have you ever felt like this? Many think, maybe work is busy, or I'm just getting older, and ignore it. I know you all work hard and I appreciate it, but what if those symptoms are actually your bodies save our souls? That's what happened with a patient at my clinic. Mr. A, a company employee in his 40s, used to be able to run up the stairs on his way to work, but lately he's been getting tired more easily. His wife brought him to the clinic. When I saw Mr. A's complexion, I thought, could it be... After running a blood test, we ultimately suspected leukemia and referred him to a hematologist. So in this video, we'll talk about the unexpected warning signs of leukemia and the lifestyle habits that can make you more susceptible to it. This video will help you understand those things. Hearing the word leukemia, many people can't help but feel afraid or view it as very serious. But that's partly because the image of leukemia is vague. By the time you finish watching this video, you'll see that by learning about leukemia correctly, you can prepare for it and ease your vague anxieties. You'll realize that there are things you can do right now, like early detection and reducing your risk. This video covers those topics, so watch until the end. So in this video, in the first part, let's learn what leukemia is in simpler terms. I'll briefly explain how the blood factory changes. Then, in the second part, I'll introduce some surprising save our soul signals from the body that you might not expect with leukemia. It's not just about getting tired easily. There are unexpected signs like bruising easily or having a fever, so please remember them. And third, I'll discuss some surprising signs of leukemia to help protect you and your family. I'll briefly introduce lifestyle habits that can increase your risk, as well as what kinds of treatments are being used. If today's lesson can help protect your life or the lives of your loved ones, I would be truly happy. Like this on YouTube. At the Medical University, we share key insights from doctors and tips to help you get healthier in today's information-rich world. That's why I think it's important to have at least one reliable source of information. If you don't mind, I would be really happy if you could subscribe to the channel. In this first session, I'll briefly explain leukemia by using a blood factory example to make it easy to understand. Inside our bodies, at the center of our bones, there is actually something called bone marrow, and this is actually the blood factory. In this blood factory, day and night, something very important is being done to protect our bodies. It creates three main blood cell types. Those are red blood cells, white blood cells, and platelets. Is everyone following so far? Red blood cells are what make blood red. Red blood cells contain hemoglobin, which carries oxygen throughout the body. If their numbers decrease, we can't deliver the oxygen we take in from the air throughout our bodies, so our whole body becomes oxygen deficient. That's why we get tired easily and become short of breath. And secondly, what do white blood cells do? They act as security guards that protect our bodies. White blood cells protect our bodies from viruses and germs. They work hard as security guards, playing an important role in our immune system. And third, what are platelets? I think many people don't have a clear image of them. They play the role of repairmen to stop bleeding. When you start bleeding, it's like they use glue to stop the blood. That's the image. So if their numbers decrease, it becomes harder for the blood to stop. So far we've discussed how three types of blood cells are made in the bone marrow, the blood factory. That's what I talked about. So, what kind of disease is leukemia? If you've listened up to this point, you'll be fine if you get leukemia. The production line of this blood factory gets taken over by abnormal cells. White and red blood cells plus other blood components. Immature cells that haven't yet evolved into proper cells keep multiplying rapidly. This is what leukemia is. Medically, these abnormal cells are called leukemia cells. And eventually these leukemia cells fill up the bone marrow, which is the blood production factory, so the normal red and white blood cells plus platelets can no longer be made. If you lack red blood cells, you become anemic. If you lack white blood cells, your immune system weakens and can't defend against germs. When your platelets decrease, your blood can't stop, and things like this can happen. What do you think? Isn't it clearer when explained this way, especially in more technical terms? There are types of leukemia, such as acute leukemia, which progresses rapidly over several weeks to a few months, and chronic leukemia, which progresses slowly over years. It depends on which type of cell becomes cancerous. There are various types, such as myeloid leukemia and lymphoid leukemia. When the lymph system becomes cancerous, it's called malignant lymphoma. Rephrase and condense the text. Keep original meaning and perspective. Retain proper names and locations. Ensure correct grammar. Output shortened version. Blood cancer is actually one of the most common cancers among Japanese people. I've explained this in a previous video, so if you're interested in how malignant lymphoma and leukemia differ, please check the description below or the card at the top right after this. So here's a summary of the first part. Leukemia is a disease of the bone marrow, which produces blood. It's a disease where abnormal factory cells multiply uncontrollably, and as a result, the three types of normal blood cells can't be produced, which leads to various symptoms. If you understand this basic point, that's a very big step forward. The second part will help connect the dots and make understanding easier. Knowing the disease's causes prevents being misled by false information. At YouTube Medical University, we explain everything clearly, including the reasons behind these issues. Next, we'll cover what you've been waiting for, the hidden dangers of malignant lymphoma. I'll explain 5 signs to look out for. Do you know these signs? Many people can't really think of the symptoms when they hear leukemia, right? Whether you know these symptoms or not can determine if you can get treatment quickly. This is very important information, so please listen carefully. 5 unexpected leukemia warning signs. Here's the first. Symptoms caused by decreased immunity include prolonged fever and recurring infections. Leukemia affects the cells that serve as security guards. These symptoms occur when the number of cells called white blood cells decreases. Ms. B, a woman in her 30s, had a fever of 38 degrees Celsius that lasted for a week. She thought she just had a lingering cold, but even after taking over-the-counter cold medicine, she didn't get better. She went to the hospital, and after a blood test, she was diagnosed with leukemia because she had a low number of white blood cells, which are the cells that fight bacteria and viruses. Something that would normally heal quickly didn't. Her cold lingered, and just as she recovered, she'd catch another. These things often occur with leukemia. If your fever stays above 38 degs for over 3 days, or if you keep getting infections that should have already healed, make sure to go to the hospital and get a blood test. The second symptom is this: pain in the bones or joints. This might come as a surprise to many of you. Actually, when children develop the disease, it's pain in the bones or joints. So, it's common for children to complain of pain in places like the knees or hips, and at first they visit an orthopedic clinic because their bones hurt. This is a characteristic of leukemia. Sometimes it's mistaken for overuse of the joints, and they're just given painkillers and told to wait and see. That happens quite often. Please remember this so you won't end up wishing you had known sooner. If unexplained bone or joint pain persists, or walking appears unusual, at times like this, remember that you should always consider a blood test. Here's the third point: bruising, nosebleeds, and gum bleeding. If you heard the first lecture, you likely know the cause. It's the third type of blood cell out of the 3. When platelets decrease, there are no platelets left to stop bleeding, so even a minor thing can cause bleeding that won't stop. Many patients visit the clinic saying, "I have bruises on my legs, but I don't recall hitting anything. When I brush my teeth, my gums start to bleed. My nosebleeds also last for more than 30 minutes and just won't stop." Especially when you see small red spots like these appearing on your skin. This could be a sign that your platelet count is low. Don't just ignore it thinking you might have bumped into something while half asleep. If you feel that something is wrong, make sure to visit a hospital. The fourth one is this: symptoms caused by anemia. This is a symptom caused by the body not producing red blood cells. What kind of symptoms do you think appear when you become anemic? You may get tired easily or feel short of breath when climbing stairs. And one thing that's easy to notice by appearance is that since there's not enough red blood, your face becomes pale. Also, with less oxygen, your heart pounds as your body tries to circulate more blood. Feeling palpitations is also a symptom of anemia. The key point is that it doesn't get better even if you rest. Your body feels heavy, like it's made of lead. These are the kinds of symptoms you might experience. Mr. A, the office worker in his 40s I mentioned at the beginning, also had these symptoms. He went to the hospital complaining of fatigue and was eventually diagnosed with leukemia. Don't just brush it off as being due to age or being busy. If these symptoms persist, please make sure to get a blood test. Please consider getting one. For the fifth point, I've summarized various things, but actually an unexpectedly important sign is there are actually a lot. For example, weight loss. When abnormal cells called leukemia cells increase in the body, inflammation increases energy use quickly, or the body can't absorb food properly. This can worsen physical condition, and that's not all. The liver, spleen, and other important organs in the abdomen actually start to swell. When that happens, the abdomen gets compressed and becomes bloated, which often makes it hard to eat and causes weight loss. I already discussed swollen lymph nodes in a previous video. It often happens with malignant lymphoma, but lymph nodes can also swell with leukemia. Please make it a habit to check the lymph nodes that are easy to feel from the surface of your body, like your neck, armpits and groin, when you take a bath. By doing so, I think the chances of detecting these blood cancers early will increase. Please be sure to remember this. And finally, let me tell you an important fact. Actually, these symptoms can also occur, especially in elderly people with chronic, slowly progressing conditions. In the case of leukemia of this type, there are often no initial symptoms. Data from the National Cancer Center shows chronic conditions progress slowly. With this type of leukemia, about 40 to 50% of people have no noticeable symptoms. There is also frightening data showing that it continues to progress. No symptoms don't guarantee you're fine, so even as you age, be sure to get checked. I think it's important to have a health checkup by your local government once a year and monitor it with blood tests. Thank you for watching so far. If you thought that's interesting and easy to understand, it would encourage me if you could hit the like button or subscribe to the channel. In the second part, I talked about various symptoms. Can you explain all 5? Please try taking notes or something. If you forgot, please rewind the video and watch it as many times as you need. Now finally, in the third part, I'll talk about the lifestyle habits that, as I mentioned at the beginning, can actually increase the risk of leukemia, as well as the recent dramatic advances being made. I'll briefly explain about the treatment of leukemia. First of all, I want to let you know that the causes of leukemia are still mostly unknown. Please understand that this is a disease that can happen to anyone. On top of that, statistically speaking, there are certain lifestyle habits that are said to be related to it. The most representative example is actually smoking. Various studies have suggested that chemicals found in tobacco, especially something called benzene, increase the risk of leukemia. In terms of quantity, it's about 1 pack a day. The results show that people who smoke for 30 years have a higher risk of leukemia compared to those who don't smoke. Smoking also causes esophageal and lung cancer. Since it increases the risk of such cancers, I strongly recommend reducing the number of cigarettes you smoke, even if just a little. It's important to consider things like going to a smoking cessation clinic in order to quit smoking. And the same goes for abdominal aneurysms. But it's also said that people who are exposed to chemicals like benzene at work actually have a higher risk of leukemia. These are workers in printing or painting industries. These people have a high risk of inhaling benzene, so they must always wear a mask according to workplace instructions. It is important to take measures to avoid exposure to chemicals. In addition, there are also genetic factors. Data also show people who had chemotherapy for other cancers are more likely to develop leukemia. However, this is still a stage where further research is needed. And even if you are diagnosed with leukemia, please don't despair alone. Compared to when I became a doctor, the treatment for leukemia is advancing rapidly every day. Chemotherapy, known as anti-cancer drugs, remains the main treatment. Medications to reduce side effects have improved, allowing us to treat patients with less strain than before. And recently, molecular targeted drugs have also been making remarkable progress. Molecular targeted drugs are revolutionary for cancer. They are drugs that attack markers unique to cancer cells. In other words, they are less likely to attack normal cells. High effectiveness is expected, and especially for chronic, slow-progressing myeloid leukemia. By taking this medication, many people are able to maintain their daily lives while undergoing treatment. Treatment has actually advanced to the point where such things are now possible. And of course, the most powerful treatment method, called bone marrow transplantation, also exists. What's important for bone marrow transplantation is the bone marrow bank. At YouTube Medical University, we previously had a person named Kazato appear in a video, and together we produced a video emphasizing the importance of bone marrow transplantation. I am also registered with the bone marrow bank. If you are even a little bit interested, please check out this video from the description box or the card at the top right. About 80% of children with acute lymphoblastic leukemia can aim for a cure or recovery. We are living in such times now. That's why early detection and immediate treatment can increase the chances of overcoming this leukemia. Please remember what I talked about today. For example, if you have a fever over 38 degrees Celsius that lasts for more than 3 days, unexplained weight loss, bruises or bleeding without any clear reason. If you notice these symptoms, don't ignore them. Please visit your regular hospital or a hematology department and get checked. And there is something important that I want to tell all of you. That is the importance of listening to your own body's signals. This doesn't just apply to leukemia. Please don't endure it thinking it's not a big deal. And don't put it off just because you're busy. Your body is your most important asset. I would be happy if you could share the knowledge you learned from this video with your family, friends, and loved ones. Just by telling someone there was a video like this, you might be able to save a life. Just by thinking about your health and watching this video to the end, I think that in itself is a wonderful action. I hope that the knowledge you learned today will protect you and those around you. At YouTube Medical University, I want to share what I believe you should know from a doctor's view. I will continue to share important medical information in an easy to understand way, so you won't get confused about which channel to watch. I would be happy if you could subscribe to the channel in advance. And also, the good button and the bad button. But either way is fine, so if you could rate this video, I will keep improving. Thank you very much for watching until the end. The way of living. I want to live like this too. There was this kind of way to live. These stories are filled with what I learned from many patients. I learned from my elders that socializing matters more than exercise, and with medicine, less is often better, regardless of age. This collection offers helpful tips for a healthy, happy life. See the description below.